With today's news, the talk of testing has once again become a hot topic. So we asked many of you watching if the president's diagnosis will urge you to consider getting tested. 11 Alive's Chanu Hur looks at that part of the story.
Dr. Frida Fisher is a triple board certified doctor at Emory University Hospital. She believes because of President Trump's positive COVID-19 diagnosis, local COVID-19 testing lines could get longer. With President Donald Trump going to Walter Reed Hospital, Dr. Frida Fisher says this now thrusts the seriousness of the coronavirus to the forefront again.
I believe that what happened with the president will make people understand that it doesn't discriminate. Anyone can get COVID-19. It must be respected and taken seriously.
That's why she says she believes testing will rev up in the state.
I do believe that more people will try to get tested, and I do hope that Georgia responds and there will be a greater need and a greater availability.
However, people responded with resounding no's when we posted the question on 11 Alive's social media. Following the president's diagnosis, are you more likely to get tested for COVID-19? One person said, if I have symptoms, so I can protect my family. Dr. Frida says testing is a good tool, but it doesn't prevent the spread. Instead, she says follow the guidelines.
Wear masks, socially distance, and have good hand hygiene.
Dr. Frida says even if you're asymptomatic but you've been exposed to someone who has COVID-19, you should get tested.